My name is Alexa Paredes, along with Chayla Fernandez and Temi Ishadare. This integrated review will be exploring stress management for hospice nurses, focusing on job satisfaction, stress management programs, and nurse attitudes towards death.
Hospice nurses are educated to provide end-of-life care to ensure the patient's quality of life is as comfortable and pain-free as possible during their final days. Nurses who work with terminally ill patients provide emotional, physical, and psychological support. They are a trusted source of compassionate care and frequently develop close relationship with patients and their family members. Over time, the stress of working so closely with dying patients, coupled with the daily responsibilities of numerous patients in similar situations, can lead to an increase of stress. Stress is an emotional and physical reaction anyone can experience when confronted with work-life challenges. Digestive problems, migraines, sleep disorders, and anxiety are just a few of the health issues that can be exacerbated by long-term stress. High levels of stress in the nursing industry can easily lead to a reduction in the quality of care and can affect the nurse's attitude towards their job. Workplace-specific issues, role conflict, and patient and family factors were recognized as major stressors. To help combat high levels of stress and anxiety associated with hospice nursing, hospitals may provide stress management programs. The purpose of this poster is to look into the empirical evidence surrounding the benefits of stress management programs for hospice nurses, in particular how stress management affects nurse job satisfaction and hospice nurses' attitude towards death.
I'll be discussing some of the major results found in the articles. Nursing is such a selfless profession in which people in the industry have developed the habit of putting the needs of patients above their own needs. Society viewed nurses as tough, resilient, emotionally intelligent, dependable, able to cope in all situations, selfless, and loyal to their patients. These expectations are raised by society, nurse managers, organizations, and sometimes by nurses themselves. However, although all these are positive attributes, the question is, how do nurses respond to the high demands brought about by work? The stress of being a hospice or a palliative care nurse can cause nurses to leave their daily duties as they begin to portray signs and symptoms of nursing burnout. Finding strategies to manage stress is essential for hospice nurses to stay healthy and satisfied with their work, which can in turn have a positive effect on patients when death is imminent. One of the findings revealed that holding a workshop can have an effective way to teach palliative care nurses helpful mental health strategies to improve stress management. Another major finding was that nurses who participated in a mobile app meditation program found the tool to be useful due to its conveniency. Another major finding is that a workplace social support is linked to less physiological suffering than personal social support. Lastly, researchers indicated that nurses with less than 2 years of work experience would greatly benefit from communication education regarding death.
Based on the data collected in the study, efforts to reduce stress management for hospice nurses include educational programs at the time of staff orientation and increasing exposure to dying patients to provide optimal care at the end of life. Empowering nurses to manage their stress through nutrition and physical activity can teach them the importance of self-care. The need for educational programs at the height of a nurse's career will allow them to develop and maintain healthy lifestyle modifications to deal with the challenging aspects of the job. Providing programs of this nature will offer less experienced nurses the necessary skills and knowledge needed to advocate for patients without negotiating their mental health and satisfaction at work. Furthermore, workplace social support can be increased through theoretical discussions aimed to create a more positive work environment and decrease psychological distress. Although there's a gap in literature regarding stress management programs and educational resources for hospice nurses, the findings from this integrative review lays a foundation for future research in exploring the most beneficial curriculum for staff development. In conclusion, we'd like to acknowledge and thank Dr. Groller, Dr. Dorney, and Christine Petcher for all of your help in contributing to this poster.